All right, welcome back to the YouTube channel. Today we're going to be talking about another one of our more common procedures, the facet joint injection. The other name for this procedure that's commonly used is the median branch block. Essentially, those two procedures target the exact same thing with a slight difference of the facet joint injection being more targeted into the joint, which makes it a little more of a therapeutic shot, whereas the median branch block is more targeting the nerve to the joint, with the idea being that if you knock out the nerve to the joint, you can take away the pain, and we'll go into the details of that. So the facet joints span from the top of your neck at the C1-2 level all the way down to L5-S1. Any of these can become inflamed. Typically, the most common cause of facet joint irritation is osteoarthritis. Obviously, trauma could play a role here. There's other systemic diseases like ankylosing spondylitis, rheumatoid arthritis that could cause degeneration of the facet joints. But it's pretty easy to pinpoint between an MRI and a physical exam. So you would palpate over the joints that are painful. There's extension maneuvers that we do to help sort of determine if the joints are the source of the pain. So it's called facet joint loading, where you can extend the patient back or just press on the joint, and that'll help you to see if that's the cause of the pain. So typically we target a couple joints. Innervation to the joints comes from above and below each joint. So sometimes it's going to be more than one needle to target the facet joints. A lot of times we'll target 2 or 3 joints at a time in a row. And the rationale there is to really cover as much territory as possible to pinpoint where the source of the pain is. So you can knock out pain from the entire lower back if you target, let's say, L3, L4, L5 on the lumbar spine on both sides. This is most commonly done for lumbar pain, obviously with people standing and walking. That's where most of the weight is. We can also do cervical facet injections. And in many cases, these facet injections are really leading up to a possible radiofrequency ablation, which is a more sort of permanent version of this procedure. So these would be done in an operating room under x-ray guidance. Obviously, you would sterilize the area, you would anesthetize the area with a little bit of local anesthetic. We use a very thin needle to target down to the facet joint under x-ray, and then we can either feel the needle going into the joint under x-ray, or if you're doing a median branch block, we're basically targeting where the nerve runs based on anatomy. Some people put a little contrast dye in with the facet injections to kind of outline the joint, or you can just put local anesthetic and steroid in there. So typically afterwards, patients will get a pain diary, and that pain diary is useful because patients need to understand that these facet injections can be a somewhat temporary solution to the problem. But even if it's temporary, that helps us from a diagnostic standpoint to figure out if that's the source of the pain. So we usually send people home with a pain diary, and what we're looking for to really prove that that's the source of the pain is about an 80% improvement in pain temporarily from the local anesthetic. And you would expect that pain relief would last at least as long as the local anesthetic. And if you have a little bit of steroids in there, you can add maybe weeks to months from that injection by trying to make it therapeutic. Most of the insurances now are sort of looking for us to do more diagnostic type injections, so more of the median branch block approach on the pathway to radiofrequency ablation. We can debate whether insurances should tell us how to practice medicine, but sort of is what it is right now in terms of going through these types of procedures. There is a role for therapeutic facet injections, but the consensus right now between Medicare and the insurances that they favor doing median branch blocks on the way to radio frequency ablation. Typically, we'll do a set of 2 of these blocks and see if the patient responds. If they do respond, then we would offer them the radio frequency ablation, which we can talk about in a future video. Risks of a procedure like this are pretty rare. Anytime you put a needle, small risk of bleeding, small risk of infection. But these are pretty rare complications. In 10 years, I've maybe seen 1 or 2 infections from a procedure, and usually they're high level type procedures, not these bread and butter ones. But if somebody's immunosuppressed, these are always possibilities. Some people do get allergic skin reactions with cortisone. Again, these are sort of few and far between. Overall, it's a very safe procedure. Literally takes minutes to do the block. Because we are blocking multiple spots on either side, you can have some soreness after the procedure. That's a little bit to be expected. I would say it's about 50-50 in terms of people who want sedation for a procedure like this. Can be done awake fairly easily, but if you wanted to get sedated, that's definitely an option. Some people do get some flush reaction to the cortisone side effect, possibly palpitation, mood changes. These are usually pretty short-lived. But the overall algorithm for this type of procedure is, one, identify that you think the pain is coming from the facet joint by doing the facet loading. Typically, facet joint pain will go a little bit to the buttock, maybe to the hip, but if you have pain shooting all the way down the leg to the foot, that's probably more of a sciatica type pain, and you can watch the video on the epidural steroid injections for that treatment. But you identify the source of it, you target it with the diagnostic blocks. If you respond well to the diagnostic blocks, you can move on to the radio frequency ablation. And that's really the pattern here. People do well with the ablation procedure, so we'll talk about that in an upcoming video. If you find these videos helpful, please hit the like button, please subscribe, and we'll put out more content for you. Thank you.